Hello, my name is Kushal Kothapalli, and I will be the one who's diagnosing you today. What's your name?
This is Dr. Mohammed speaking, and this is your patient. You can see on the screen there, and you can go ahead, please.
What's the patient's name?
Yeah, sunanki? Yeah, my name is Habiba. Yeah.
Okay. Can Habiba describe herself like about her family?
All right. Yeah, mijinki yana nan har yanzu? Okay. Kina wani aiki ne? Okay, baki wani aiki. Mijinki yana aiki na shi? Okay, okay. So Habiba is 55-year old. She is married. She has 7 children, and she is not gainfully employed. And she also married.
Can you repeat that, please? You're kind of. I think your internet cut out.
Okay, so I don't know what just happened, but we can start again if you want to, because you only got like a little bit of the way in.
Yeah, it's fine. Yeah, we'll just start again.
I texted Marshall, so hopefully we're getting it worked out.
Still working. It's still recording. Just saying.
Oh yeah, sure. I'll probably just leave it, and so Ella can edit it.
What happened, guys?
I think their internet cut out, so they're joining back.
Yeah,
Okay.
Welcome back. We're back.
Okay, so you
Okay.
guys, we want to start over again?
Yeah.
We wanna
Yes,
one
yes,
clear
please.
shot. Okay,
Yeah.
perfect. All right, Emily, keep me updated. Good luck again, guys. Bye.
Yeah.
Good.
Yep, go ahead.
Okay. Hello, my name is Kushal Kothapalli. What's the patient's name?
The patient's name is Habiba Mohammed.
Can the patient describe a little bit about herself, like her age, her family?
All right. The patient is a 55-year-old. She's married. She has 7 children. She is not gainfully employed, and she's married to a retired civil servant.
Okay.
Yeah.
Can you ask her what she does for fun? Like, yeah, what she does for fun?
All right. Idan yana so ya dan san ki ne, yana so ki dan mishi bayani. Kaman me ne kika fi na shakatawa? Kina son ko kallo ne ko jin waka ko kuma wani abu dai me ne kike yi na shakatawa haka? Okay. So she said she loves listening to news. That's
Okay.
what she loves doing.
May you ask her what type of news she likes?
What type of?
News she likes.
All right. Radio wani iri ne kike ji? Labaru ne irin na. All right. All right. So she loves to hear news about uh, politics and also some of the programs they do on the radio stations, some dramas, and that she loves it and she follows it.
That's nice.
Yeah.
Can you describe a little bit about why you're here today?
All right. So mene yake damun ki? Me yasa kika zo asibiti? Mm, okay. All right. So she said she came to the hospital because she has fever, headache, and generalized body weakness.
Okay, that's interesting. Can you ask her when these symptoms started? How many days ago did they start?
Okay, su wannan su zazzabin naki da ciwon kai din nan yaushe ne ya fara? Yaushe suka fara? Su zazzabi su ciwon kai din yaushe suka fara? All right. Yeah, she said that it all began yesterday.
Yesterday? Okay.
Yeah.
Um, can can you also ask her like what she was doing at that time when it started? The symptoms started.
Lokacin da kika fara jin su jiyan nan kafin ki fara ji akwai wani abin da kike yi ne tukunna kika fara ji wani abin da kike yi a lokacin. Okay. So shine baki samu kin yi bacci ba. Okay, so she said it started when she was actually attending to her two children. They were sick and she didn't get good sleep. So throughout the night, she was with them, attending to them. So that is when her symptoms began.
Oh, okay.
Yeah.
Um, can you ask her to describe the fever? Is it like on and off, or is it just continually progressing to get worse?
Okay. Zazzabin kin nan ya zo ya tafi ne ko kuma yana nan kowane lokaci? Okay. Okay. So dai zazzabin dai kaman zai zo ya tafi ne dai kawai. Okay. She said the fever comes and go.
So it's like on and off, right?
Yes.
Can you take her temperature for me?
Yes, her temperature has been taken 37.9 degrees Celsius.
So it looks like she's fine right now. Can you ask her to describe about the body weakness? Is it like continuous and like after some time she can't do anything? Is it affecting her day-to-day life? Can you just describe a bit about that?
Okay, so mutuwan jikin nan da ki dan yi bayani akai ne yaya yake yana hana ki yin ayyukan ki ne ko kuma duka jikin naki? Okay, amma baya hana ki yin ayyukan ki? Okay, she said that she can manage to do some of her day-to-day activities, but she used to feel the pain generalized everywhere.
Okay.
Yeah.
And also about the headache, is it just like situated into one spot or is it just around the head?
So ciwon kai din nan fa, gaba ɗaya kai din ne ko wani gefe ɗaya ne a kai ki? Okay, ta gaba ne. All right. So she said the headache is frontal. It's frontal headache on the forehead.
So can you ask her if she has any other symptoms such as abdominal pain, a runny nose, or a sore throat?
Okay, kina jin wani abu ne banda wa'annan ko ciwon ciki ko wani abu daban banda su zazzabin nan? Babu? Okay, she said these are the only symptoms that she's feeling, no abdominal symptoms, no respiratory symptoms.
Okay. Um, okay. So right now,
Okay. Please go ahead, Kushal.
oh, I thought she was saying something. That's why I was waiting.
Okay.
Uh, um, so right now, I'm thinking that based on her on and off headache, I mean her headache and her on and off fever, I'm assuming that she has malaria. So can I please have a diagnostic test?
All right. Yeah. Yes. Rapid diagnosis text for this patient reveals 2 clauses of malaria.
Thank you. And also, common side effect of malaria is anemia. So just all of her body ache. So can you just check her hemoglobin levels to make sure they're all right?
Yes. The hemoglobin level for this patient is 13 grams per DL.
Okay.
Yeah.
So everything seems. I just want to make sure and have one more test. Can you have a blood culture to see if there's any bacteria present in her system?
All right. Blood culture did not yield any bacteria for this patient.
Okay. So I think we have all the information that we need right now.
Yeah.
Based on your symptoms, I'm gonna say this is malaria, and it says 2+ of malaria, and uh, you also have anemia, which is it's mild anemia. It's not that too much. So I would just say prevention technique, some treatment technique first. For some treatment, I would say we should use some oral ACT treatment to help with the malaria. And if she's in supportive care, so if she has a fever or if she's feeling other symptoms, maybe just use antipyretics and that stuff. And then also for her anemia, it seems pretty normal. So I would just say oral iron supplements are enough, and oral iron supplements are enough, and she could just modify her diet a bit to eat more iron-rich foods such as meat and some more vegetables.
Okay. That's correct. The history, you got it correct. This patient actually has malaria from the history she is presenting with.
Yeah.
And you did the right treatment, the right diagnosis, RDT for this patient, which reduced the process of malaria. And the treatment you also did well. You used the oral LCT because this patient is not having a complicated malaria, and you also went ahead to give treatment for the moderate anemia this patient is having using iron supplements and also diet, which is
So
very good. You actually did well. And for the
before
prevention,
before we
prevention, for that prevention.
before we finish, I would just like to talk about some prevention. So she
All
was
right.
saying she was saying she was up all night trying to for her children. I would just suggest that she wears long clothing, and she also makes sure that she goes to sleep and using mosquito netting just to make sure that mosquitoes don't bite her as often, as that is the main cause of malaria. And then also for anemia, just diet changes. She should have um, more of iron, like iron-rich foods such as vegetables and meat. So I think that's all. So that's just ways to prevent malaria
Yeah,
in the
that's very
future. And
good.
if you has any questions for me?
That's very good. Kushal, you did very well. The prevention is very good. Long sleeves, mosquito netting for malaria is very good. You mentioned the correct
Okay.
stops there. And the anemia also prevention. You mentioned the correct stops. That's very good of you. So I think we have come to the end.
Yes. Thank you, and I hope it gets better.
You're welcome. Ya ce yana gode miki. Yawa, she said she's also thanking you guys for what you guys have done to them. All right. So she's also thanking you. Yeah.
Bye bye.